Hi everyone, Dr. Emmy from Pain Free and Fit. Today, one of the best and most effective exercises for low back retrolisthesis pain. Hope you enjoy.
So one of the hallmark findings in retrolisthesis for many patients is that pain is aggravated with flexion, meaning that the curve in the lower back, the lordosis, when that curve decreases and the tailbone goes under in a posterior pelvic tilt, or the rib cage slumps forward like you're bending to touch your toes, and that curve decreases, the front of the spine is compressed and the back of the spine is open. And that emulates the normal problem in most retrolisthesis cases, which is that accentuated flexion allows the vertebra to translate or to move slightly backwards. And that overstretches the back of the spine, like the facet joint capsule on the back of the disc, and it overcompresses the front of the spine. So to undo these effects, one of the most powerful exercises you can do is to train the muscles that lift the rib cage up in extension and raise the tailbone in extension, meaning that you're going to increase the arch of the back. Again, this is typical for most retrolisthesis cases, but not all. You have to do an assessment or an analysis on your body mechanics, your movements, your posture, and find out what aggravates your pain. So for this particular video, we're going to be talking about two great exercises that can be combined into one to both help both of those things, thoracic extension and pelvic extension, so that it decreases the pressure on the discs, on the facet joints, on all the ligaments, tendons, and muscles in the low back and retrolisthesis cases, and it encourages a slight forward movement of that vertebra, so that in the instability of retrolisthesis, where that vertebra is not held solid, but because of ligamentous laxity, it has a tendency to move back. These exercises, both of them, as well as combined, will help to encourage that vertebra to move forward as that curve is increased. So in the first half or movement of the exercise, we're going to affix a band around our upper thighs, just below the buttocks. We're going to anchor that at a point that's slightly below, so we have a upwards angle to the band. And the exercise is done by tilting the pelvis into an anterior pelvic tilt, meaning that the pubic bone is moving down, the tailbone is moving up. And as you anterior pelvic tilt, you're going to notice the back of your thighs are pulling that band, and there's resistance to that motion. That's a strengthening exercise for the extensors of the lower back, particularly the multifidus muscles, more than the erector spinae muscles. Now, this part is indicated for those retrolisthesis sufferers that have had pain because of too much tail under. If you do an analysis on yourself or an assessment of how your posture and your movement and your body mechanics relate to your pain, like we have at the painfreeandfit.com website, and all of our programs have included in them, you'll find that too much tail under starts to aggravate lower back pain. Too much knee to chest motion, which is an exaggerated form of posterior pelvic tilting, aggravates low back. Sitting slumped with your tail under aggravates back because it puts pressure on the discs on the front, squeezing that nuclear inner material towards the back into herniations and bulges. It overstretches or aggravates the facet joint capsule and tendons and ligaments on the back of the spine. So the opposite motion of anterior pelvic tilting, or increasing the arch by the tailbone moving up and the pubic bone moving down, actually relieves the pain. So this is perfect for this lower half of the exercise, and we're just simply using resistance to do that, where we're going to be raising the tailbone, holding for a second or two, and then releasing against that resistance. Now, from the beginning, you have to realize that it's more important to develop endurance in this exercise than it is pure strength, more of an endurance strength exercise. So you want to keep the resistance low and you want to shoot for higher reps. That's your first goal. Where you start, it doesn't matter, 5 reps, 10 reps, but the goal is to build to 100, 200, 300 repetitions, as well as slowly and gradually increasing the hold time of the position, so you're building that type 1 endurance fiber matrix that's in those multifidus muscles and erector spinae muscles. The second half of the exercise, we use a separate band, and again we're going to affix it at an anchor point that's below where we're holding, and we're going to hold that band at the front of our chest. This band is going to be used to provide resistance to thoracic extension, which is making your rib cage move up. This is perfect for those retrolisthesis sufferers who find pain with slumped postures, by bending forward at the waist, trying to touch their toes, for instance, by sitting with the rib cage slumped. That pressurizes the disc from above. It's the same thing. It's flexion. It's losing that curve in your back, but it's the opposite direction. It's not the pelvis that's going into flexion. It's the thoracic spine that's folding and causing lumbar flexion. So in this case, patients are going to find aggravation with slumping or bending forward from the waist, and relief by raising the rib cage up, from leaning back, from, let's say, laying prone and doing McKenzie work where they're pushing their bodies up in a press up and they find relief. These retrolisthesis cases are going to benefit from targeting the extensors, primarily the erector spinae, strengthening thoracic or mid-back extension. And the way we'll do that is this band simply held at the chest, keeping the rest of the body motionless, going into a slight slump, a range of motion that's comfortable, not painful, and then extending up. And again, as you do that, you're not pulling with your hands. Your hands are simply anchoring that band against the front of your chest. And as you raise your rib cage up, you'll notice your lower back, if you do it with one hand, will again, just like the previous half of the exercise, will increase its arch. But now the arch is increasing because the top of the spine is bending back, not the bottom of the spine bending up and back. So you can combine these two. If you notice that you want a targeted approach where you're going to increase the strength of the muscles that both pull the pelvis into anterior pelvic tilt and the thoracic spine into extension, you can use them both at the same time. So simultaneously, I'll be raising my tailbone and elevating my chest. And that's a powerful movement against that extension. You'll feel all those lower back muscles contract. You'll feel the arch of your back increase. Again, you want to use a range of motion that's comfortable. Too much arching aggravates. You can't go that far. The overall range of motion could be as little as 1/4 of an inch. It may be up to an inch or even 2 inches sometimes. So use a range that feels comfortable. Again, this top part is based on analysis that you found pain with flexion or bending forward from the thorax, and you found relief with extension. Now we can also take both of these exercises and increase the extension effect by using a 2x4 or a slight elevated surface behind us. If we step on it with our heels, naturally that's going to put myself into a slight anterior pelvic tilt where the pelvis drops into that position. I can use this to accentuate the bottom motion as I extend on the top. And again, from the beginning, I would suggest 2 to 3 second holds using both patterns if they both are relieving to you. If one pattern is more relieving, let's say the pelvic tilt, then focus on that aspect of the exercise. Or if the thoracic extension is more relieving and you found in your posture and movement analysis that that's what you need, that's what you want to focus on. So plug this one into your rehab. Again, start with whatever feels comfortable, 10 reps, 15, 20 reps. Add 2 or 3 reps each workout. Again, for strength gains, for progressive improvements, you don't want to do this exercise every day. The frequency is 2 to 3 times a week, but add 2 or 3 reps, no more than 5, and shoot eventually for 50, 100, 200, 300 reps, and then increase the tension by moving further back, starting over again at, let's say, 50, and then increasing that endurance time that you hold each rep, as well as the overall number of reps. Now, one more consideration when performing either of these exercises or the combined version is to include any lateral flexion or rotational corrections that you need. If you found in your analysis that you have a tendency, for instance, to rotate your hips to the left more than the right, you've developed an asymmetry between your oblique muscles, your erector spinae, your latissimus. You want to make sure that you're holding your pelvis into the correct position, away from your typical tendency. Same thing with any thoracic. Based on our lifestyles, our postures, our daily movements, we all develop asymmetries, and you want to include those asymmetries in an exercise because you want to tailor the exercise to your specific body mechanics. Your results will be so much better than if you just use this as a generic exercise. Lateral flexion problems, such as typical problems of leaning to the right or the left, many retrolisthesis sufferers have. They can bend easier more to one side than another. They have pain with one side. You want to take that into consideration while performing this exercise so you're slightly leaning away from the pain. People that hip hike, which is very common, where they have one hip that comes up more than another, either due to leg length inequality or, for instance, a leg that turns out when you walk more to one side, which hip hikes that side up. You want to take that into consideration by bending that side of the knee and holding the hip slightly down to maintain a level pelvis. So all these things are going to be in my consideration while I'm doing this. As well as if I have an inhibited, let's say, multifidus muscle, I need to learn through other exercises that we've shared on this channel how to activate that multifidus so you can make sure that your weakest link in your mechanical chain is being targeted with these exercises. If you have any questions or comments, write into the channel. I'll do my best to answer them. Give me a thumbs up to help me share this valuable information with others. And remember, if you're looking for a great program to figure out all your body mechanics as it concerns retrolisthesis, to do a good detailed analysis on how you have to target your particular weak links and your posture and movement tendencies as they relate to your pain, check out our fast track program for retrolisthesis available at painfreeandfit.com. It has a full detailed analysis as well as a step-by-step program to bring you through the different exercises that you need, how to tailor build your routine to get out of pain and back into fitness without hurting your lower back. I hope this video on retrolisthesis, one of the most powerful and most effective exercises with thoracic and pelvic extension, helps you with your chronic low back retrolisthesis pain.